Okay, it looks like we have someone arriving shortly. Hello there. Are you the patient we're waiting for today? Pleasure to see you. I'm Dr. I. Are you here for the eye exam? And you asked for the relaxing eye exam, correct? Perfect. It looks like this is covered under your insurance, so it is great to see you and pleasure to meet you. How are you doing today? Tired? We will help that right away. Please take a seat at the medical chair that's right in front of you, and I'll give you just a quick breakdown of what we're going to do today, so please sit down. Good. Are you cozy, by the way? We do add this really relaxing sleep foam memory mattress into the chair. So, could I first get your first name and last name? That's a beautiful name. How do you spell that? Is that with an I-E-Y or something I don't know? Okay. And can I get your birthday with the year? Great. Does that make you Gen Z or Gen Alpha? And last question. How has your vision been within the past 2 months? Have you seen any changes with your vision that I should know about? Okay. You just appear to be really tired. Your eyes are just a bit irritated. Did you notice that as well? Okay. So we're going to just give you a basic test. Just testing your vision today with different elements and aspects. But it's going to be pretty relaxing. We're going to see if it helps you close your eyes to sleep, okay? Glad you understand. I'm going to get my gloves on now. Do you have any allergies that I should be aware of? It is allergy season. Okay. And this is going to be a little bit educational, as I'll explain every step. When was the last time you had your eyes checked? Perhaps 2 months ago, maybe a little bit longer. Okay. And do you wear contacts or glasses at all? They can even have no prescription whatsoever, like blue light lenses. Okay. Let me write that down before we continue. I'm going to first begin by checking your eyes with a pen light. It's going to be a little bit bright, but I'm going to turn the lights here off just a little bit, okay? Okay. Here's the pen light. I'm just going to shine this over your eyes. Focus right at my forehead. It shouldn't be too bright. Just look at my forehead. Good. And can I touch right there at the side of your face? Perfect. Keep looking at my forehead. Good. Good. Great. Good. Can you look at my nose? Good. I'm going to ask you to look right at my finger now. I'm going to move my finger side to side. Just follow my finger. One more time. Good. Follow my finger. I'm going to ask you now to look at the light. If it's too bright, please look away or use your peripheral vision and follow the light above. For example, if the light's pointing at me and I think it's too bright, I will simply follow the light without looking at it. Okay, so just try your best. Follow the light. We're looking for something called nystagmus. And all that means is that we can see your eye moving and wiggling like that. Looking at the light. Good. Great. Okay. So I did not see any signs of nystagmus, but your eyes do look really tired. I'm going to give you 2 types of eye drops. So this first one here, before we add these yellow drops that dilate your pupils, this one is an eye drop that we add to moisturize the eyes before that. Can you look up, just up there for me? Good, we're gonna do this eye first. Look up, 3, 2, 1. And then can you blink? Can you blink again? One more time, blink. And then one more time, blink. Great, we're gonna do the other eye now. You should already feel that your eye feels super moisturized and refreshed. Good, we always add this one before the yellow eye drops. Okay, look up and keep looking up. Okay, same step as before. Can you blink for me? Blink, 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 blink. Open. Good. 2, blink, 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 blink. Open. Good. 3, blink, 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 blink. Good. 4, blink, 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 blink. And look at me. Okay, that seems to have done perfectly with your eyes. Do you feel any irritation? Okay, let me know if that changes at all, okay? We're only here for your health and your wellness. So I'm going to get the yellow eye drops now, which will dilate your eyes. I will tell you, this will make you feel very sleepy. So there is a yellow dye in this, and it helps me see in your eye. Okay, are you ready? Good. This one will make your eyes very sleepy, I will say. And I'll let you know when in the exam you can close your eyes. So, can you look back up there for me? Good. I'm going to apply that here. Good. Blink for me. Good. Blink. Blink. You should feel that it's instantly making your eyes very sleepy. That's just what it does when it dilates the pupil. Blink. Good. And blink again. Okay. And on this side. Ready? Let's start. Okay. And again, are you ready? Blink. 1. Blink. 2. Blink. 3. Blink. 4. And now blink with both eyes. Blink, 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 blink. And open. Good. Okay, your eyes are already getting dilated. And do you feel that your eyes are getting super sleepy so far? Good. I'm just going to put a bit of pressure around your eyes. Can you let me know if you can feel that? We're just going to wait until that actually sets in. Can you feel this right there? We're just testing the musculature around the eyes. Good. Okay. I'm going to put my hands right above your eyelids. Okay. Can you feel that? Good. You can feel that. Close your eyes. I'm just going to tap over each eyelid. Close this side. Good. Good. And here. Good. Good. Great. Okay. That has settled in perfectly. No reaction. Okay. I'm going to first start by taking a couple photos of your eyes. Okay. So I'm going to show you. This is our otoscope with the eye setting on. I'm going to turn even the top light off this time for this. And there we go. Sometimes it chooses not to work, but that's okay. I'm going to take a couple photos, and all I'm going to need you to do is look at that light that's right there. Good. Can you look right at that light? I'm just going to look really into your eye, and all you need to do is look at that light that's right there. Okay, we're going to take a couple of photos. You're going to hear the click, click, click of the camera. Okay, are you ready? Let's start. Okay. A little bit closer now. Okay, can you look right back at that light right there? Good, you're doing amazing, as you always are. Okay, I'm just taking a look deep into your eye and looking at the retina. And we're looking to see if we can find any anomalies, but your eyes look beautiful. In fact, you have a beautiful color of your eye as well. Okay, and one more time. Good. Okay. So we took the photos. Let's make sure that the computer has this uploaded, because I always send this to a secondary ophthalmologist. Great, that's sent. We're gonna do this eye now, okay? Same rules. Look at the light while I take some photos and look into your eye. Okay. Can you take a look right at that light right there? Good. It's just a little bit bright. I apologize, but if it's too bright, remember, look right above, okay? Let's take some photos. Let's see. Okay. Okay. Great. So we're at 20, 15, 12, 10, 8, 10, 8, 6, 5, 4, 5, 4, 3, 2, 1. Back to 0, so that should be the brightest. I apologize. Just taking a couple of photos here. Okay, and look at the center now. Okay, I'm actually just going to be taking a photo of your eyes, generally from the front. 1, 2, 3, 4. Okay, great. So, it looks like that was good. Do you feel a little bit tired? Close your eyes for 10 seconds while I get ready for the next step. 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. Hello, open your eyes again. I'm going to be giving you something called a color panel test now. And you have a decision. We can use these color panels to test your field of vision with colors, or these ones are my favorite, I will be honest. We can use the color cubes. Which do you prefer? The color cubes. Good choice. Now, do you have any color partialness? For example, I'm unable to see certain shades of pink and orange. Okay, well, I guess we'll find out today. Just let me know, what color do you see? Are you ready for the color blindness test? Let's start. What color is this? That's 3, 2, 1, like a yellow, orange. Okay, good, correct. What color is this one? Take a look. 3, 2, 1, that's blue. Good. Okay, are you ready for the next one? This one, in my opinion, is the best looking. It's very beautiful. What color is this one? Take a look. 3, 2, 1. It's like a green, maybe a little bit of like a turquoise. Good. What color is this one? 3, 2, 1. That one is classic green. Okay. And what color is this one? Take a look. This one's beautiful. It always makes the sun shine. Like right up there. Look gorgeous. 3, 2, 1. That one's orangey yellow. Good. Okay, so you can see blue, green, yellow. Those are one set of colors. We're going to grab the second half now. Okay. Are you ready? Okay. What color is this one? Take a look. 3, 2, 1. Clear or crystal ice is what someone say. It kind of looks like you're in an ice cube. It's beautiful. I love this one. I almost think it's slightly blue. Do you agree? I love it. Okay. What color is this one? Take a look. 3, 2, 1. This one is purpley violet, almost pink in a way. Yes, good answer. Okay, what color is this one? 3, 2, 1. That one is pink. Exactly, this one's like a princess pink. It's beautiful. Good. To me, it almost reminds me of candy. Okay. What color is this one right there? 3, 2, 1. This one's classic yellow. Very good. And this one is the most important. I'll explain why. What color is this one? 3, 2, 1. Perfect. This one's red. I'm actually going to keep this cube over your eyes. Can you see the light? Good. Can you see the light here? Good. What color is that light? Is it white or is it kind of a red yellow? More like a red yellow. That's exactly as expected. Can you look at the light there? And there. What about here? Here. And at the center. Good. How many fingers am I holding up? 2. And now 1. How many fingers do you see? 2. 1, 2, 1, 3, 2, 1. Okay, good. So the reason why we leave red for last is we're trying to see if you can identify red. It's called the red test. No, the name is not unique, but it works for what it is. Good job. Okay, we didn't see any color partial differences. I will quickly test you with the color panel test now. I'm just going to ask you between 2 colors, which one is the brighter color? Okay. Let's choose right here. We're going to go with this one and this one. Take a look at these 2 colors. This is 1, that's 2. Which one's brighter? 1 or 2? 3, 2, 1. This one's brighter. Okay. And one more time. Which one's brighter? We have 2 different colors here. This one's 1, that one's 2. Which one's brighter? 3, 2, 1, 2. Okay. And very quickly, which one is brighter? We've got 1 and we've got 2. This is the most difficult one. Which one do you think is brighter? 1 or 2? 3, 2, 1, 2. Good. Okay. So I could see you were able to differentiate many of the colors. That's great. Okay, I'm going to test your up-close vision now. with a Snellen's chart. There's one behind me, but we test that second. I'm going to test this one first. So, with this about 1 meter in front of you, I'm going to point to several of these letters. Just try to name them as best as possible. And let me get my pointer out. It is right here. Okay, this is my pointer. Can you see that letter right there? What letter is that? That is E. Good job. Any difficulty? You're doing great. Line 2, we're going to move down to that one. What letter is that right there? 3, 2, 1, T. Let's see. Do you have any difficulty reading line 3? Nope. Line 4. What about line 5? Perhaps a bit of difficulty there. Let's try. Can you read the first letter in line 5? 3, 2, 1, D. Very good. Second letter, 3, 2, 1, H. Can you look at the last two? These are the ones that get the most confused. What letter is the second to last one? 3, 2, 1, B. And this one's the most difficult. What is that? 3, 2, 1, S. It's often confused for 8 or B. Line 6 should be a bit more difficult. What's that second letter in? 3, 2, 1. That's P. What about the fourth letter in? 3, 2, 1. That's Z or Z. That's Z. And last letter, 3, 2, 1. It's O. I'm going to move all the way down to the last letter on the line now. Let's do the last letter on the last line. What letter is that? 3, 2, 1, H. Okay. Keeping the chart here, there are 2 colors on this chart. One is red and one is green. Let me know which one I'm pointing at. Which one am I pointing at? Red or green? 3, 2, 1. That is red. Very good. Okay, you passed the up close test. Let's test from far away now. I'm going to actually try to use this to identify it. Can you see that I have something on the chart? Perfect. We're going to go all the way down to line 6 here. Can you read that last letter right there? What is that? 3, 2, 1. That one is P. Very good. We're going to go down to line 8, which is actually the last line you could have seen on the handheld Snellen's chart. Can you tell me, what is this letter right there in line 8? 3, 2, 1. It is F. Okay. What's the letter next to it? 3, 2, 1. P. Very good. Let's move on to line 9. It should be getting a bit difficult here. Most people are unable to see it. Line 9. What is this third letter in? 3, 2, 1. F. Very good. And the last letter in line 9. 3, 2, 1. That is T. We're going to make it a bit more difficult now and go all the way down to line 10. Right there. In line 10, what is that second letter in? 3, 2, 1. This is where we make a mistake. That is actually D. Now that I know the limits, let's test line 11, okay? What is this one in line 11? The third letter in? 3, 2, 1. Too difficult to see? That's okay. That one is Z. So we made it to line 10, it appears. Line 10. Line 10, which puts you at 20/13 for the vision. Okay. That's actually better than the average that they can see. You have super eyes. That's amazing. Okay. And we're going to do a couple last tests here just to test your vision before we find you some frames. So we're going to do something called the lens 1 or 2 test. And we're going to see which one you think looks better. Lens 1 or 2. This part is so relaxing, most people fall asleep. It is okay if you close your eyes. And let's test your vision. What looks better, lens 1 or 2? Okay, here's lens 1. 2. 1. 2. So what looks better? Lens 1. 2. 1. Or 2. 3. 2. 1. Lens 2. Good. Okay. Let's move that around. Okay. What looks better? Lens 1. 2. 1. 2. 3. 2. 1. Lens 1. Or 2. Lens 2. Unsure? Let's flip it around. Let's go this direction. What looks better? Lens 1. 2. 1. 2. Lens 2 this time. Good. So that is the negative 2.0. You got them correct. Okay, so this one, let's make it slightly a bit more difficult with the 0.5. Let's start. What looks better? Lens 1 or 2? 1. 2. 1. Or 2? 1. Or 2. 3, 2, 1. Lens 2 perhaps, or 1? 2? Okay. And let's flip that around. Lens 1. 2. 1. Or 2. 1. Or 2. Lens 1, you say, okay. Okay, and let's flip that around. And one more time. Lens 1. Or 2. 1. Or 2. 1. Or 2. 1. Or 2. What looks better? Lens 1. Lens 1. Okay. We only had one mistake there. So lens 1, which still puts your vision at 20 over 20. That's fantastic. Okay. That's actually the best results we've gotten in the past month. Amazing work. Okay. We are now going to test your eyes until you're able to close your eyes and see when we can calibrate them when you awake. But before that, let's fit you with some frames. They will be blue light frames, and they'll be slightly corrective for the up-close vision, as that was the only issue we found, which wasn't really an issue at all. In fact, your vision is better than the average person's, so congrats. Okay, we have some amazing frames here. Are you ready to try some on? Perfect. And we're first going to start off with these. These are Louis Vuitton, made in France. Actually, I think these are perfect for you personally. They give you the luxury type of frame without it being too outstanding. Let's try these on. How do you feel with these? What do you think? Let me show you a mirror. I have one here somewhere. Fantastic. What do you think? Cute, but not your style. That's okay. Let's just remove that. Okay. The next one that we have. These are gorgeous. These are Chanel. Very fancy brand name. Let's try these on. These out. Chanel. Okay. Careful. Okay. Here's the mirror. What do you think? Cute, but too bold. Understandable. Okay. Let's remove that. How do you feel about the color red? Too bold? Let's try the crescent moon lenses, because these are just the frames with none of the top. Are you ready? Let's try that on. Okay, take a look. Too bold. Understandable. Then I think you'll like these last ones the best. Okay. These are Valentino. Super designer friendly, and they are the classic glasses. And again, I think you're gonna love these ones, so these are probably perfect. Then let's try them on. Okay, let's see. Gorgeous. And I would love if you could take a look. What do you think? Stunning. You look beautiful. As expected. Yes, what do you think? Gorgeous. I know. You are stunning. So these are the ones you'd like? Okay. Perfect. We're going to take these frames and create the perfect blue light lens glasses for you for whenever you work in front of the computer, or if you're in front of like the lights that we have here. These are LED lights. They cause a lot of tired eyes. So I just want you to know that we are paying attention to everything and making sure your eyes are okay. Great. So I've written your information down, and I'm gonna have to sit you here for about 20 to 30 minutes just to wait for your eyes to calm down, and then we may or may not see you again afterwards depending on how that reacts. Okay, good. Thank you for coming on by to the eye clinic. Again, I will also see you again in 1 business week for you to pick up the frames and retest your eyes to make sure that those glasses actually fit you properly, because your health is our business. Okay, so you can close your eyes here while I take some notes, but we're just making sure that your eyes react well to the eye drops. Okay, and again, if your eyes are a little bit irritated, we'll just retest you one more time. Okay, thank you so much for coming on by. Again, I'm Dr. I will be your eye doctor. And have a great night. Cheers. for the eye exam and lens fitting. Perfect timing. I was just waiting for your appointment. Please do, if you could sit right there on that very detailed looking chair. It is a little bit intense, I know, because there's a lot of eye equipment next to it. Sit down right in front of me, okay? And get cozy. Good. I'm gonna move myself up a little bit closer. And a bit of an introduction. Hello there. I am Dr. I. It's a pleasure to meet you today. Yes, truly. And I'm gonna quickly get your name and birthday so I can add that into the computer first. Beautiful. And how do you spell your last name? Gorgeous name. Birthday and year. Okay, so to double check, it appears that we're going to be checking your eyes, your eye health, and to see if you need a new pair of glasses today, correct? Good. I also have on my books that you want to try on some lenses as well to see if you want to get them from here. Good, perfect, perfect. Well, a couple of questions before we begin. I know I've been asking you a lot already, but this is very detailed and I need to know every piece of information, okay? Good. So, do you currently wear any glasses or perhaps any types of contacts, maybe different types of lenses? Okay, and are the glasses or contacts specifically for helping you see, read, etc., or are they just for blue light? Okay. Okay. I have all the information here. Now, would you say that you see better up close, or do you think you see better far away? Or maybe you have a problem seeing up close, or maybe you have a problem seeing far away. Okay. Have you noticed any changes with your eyes within the past, I would say 2 months up to a year? Or do you think it's been the same? Okay. And do you have any eye problems or concerns that you think I should check out or know about? A lot of the most common ones are very strong lights that we see throughout the day because of cell phones or computer screens causes our eyes to be sore. Do you have any problems like that? Okay. And last question, how is your sleep? Yeah, not the best. Sometimes that can be caused to the blue light that we see, so I'll make sure to keep the lights lower, as I typically do for these exam rooms, okay? Good. So, I'm gonna get gloves on first, and we're going just to first touch around the eye. Okay, good. And how is your day going? A little tired? That's okay. Sometimes for these detailed eye exams, some people fall asleep and that's okay too. Okay. So, may I touch your face? I'm going to place my hands just around your eyes. All I need you to do is let me know if you can feel my hands around your eyes, okay? So I'll just ask you yes or no, and you say yes or no. Good. Perfect. So, a little bit of pressure right there. Yes or no? Good. Other side. Yes or no? Good. Under. Yes or no? And then I'm going to take my hands and put them around your eyes like so. Yes or no? Okay. Do you feel any signs of vertigo or any signs of feeling imbalance after I put a bit of pressure on your eyes? Okay, not so much. Perfect, okay. I'm going to get out my pen light now, and I'm going to see how your eye reacts. Okay? I'm looking for your pupil. So, I'm gonna ask you to look where my hand is wiggling. Don't look at the light. I'm gonna shine that next to you, okay? Keep looking at where my hand is wiggling. Good. Other eye. Look where my hand is wiggling. Good. I'm gonna put my hand over your eye right now, okay? Careful. Careful. Okay. Good. Look where my hand is wiggling. Don't look at the light, please. I'm looking all around your eye. Good. Now please look at my nose. Let's see around your eyes. Good. I'm just making some notes. Just keep looking at my nose, okay? So the pupil seems to be perfect. On this side, right over there is the left, and this one on the right, okay? So it appears that we are having the eye functionality be good. Please keep looking at my nose, okay? Gonna get a little bit closer now. Just look at my nose. So it looks like we are seeing the pupil dilate as I pull the light away and recess perfectly when I apply the light. So that's perfectly what we were looking for in this situation, okay? Okay, you can relax now. No need to keep looking at my nose. And now I'm going to ask you to do a series of tests for me, okay? It's going to use the light. I'm going to ask you to follow the light to the best of your ability and don't look at anything else. Okay? Let's begin. So, just carefully follow and look at the light, okay? Follow and look at the light. Follow the light. Follow the light. Good. You're doing great. You're doing great. Good. Now I'm going to move the light a little bit faster. Keep following the light, okay? So follow the light. Good. Follow the light. Good. Follow the light. Okay, other direction. Follow the light. Follow the light. Follow the light. Follow the light. Good. Okay. So, what that was testing is to see if you have any sort of eye problems. The thing that we're looking for is called nystagmus. What that is when your eyes flutter because they're constantly focusing on something else. When I test with the light, it helps me see if that is elevated or not. Okay. Okay. Now I'm going to test your left eye and your right eye. you see the light still? Good. We're covering your left eye. Okay. Can you see the light? Good. Okay. Removing the light. I'm going to ask you a series of questions, okay? Let me know. How many fingers am I holding up? Perfect. How many fingers am I holding up now? Good. How many fingers am I holding up now? Good. And how many fingers am I holding up now? Good. Okay. Other eye. Let me know. How many fingers am I holding up? Good. How many fingers am I holding up? Good. How many fingers am I holding up? Good. And how many fingers am I holding up? Good. Okay, so it appears that your left and your right eye are pretty similar. Okay, and we are going to move on to a eye lens exam. You may have seen it behind me, but we're going to test the prescriptions of your eyes, okay? Before we begin that though, I'm going to test your peripheral vision just pretty quickly, okay? What I want you to let me know is when my hands move out of your visual field. I always test this before to see if the glasses are a fit for you. Good. So, I'll give you an example. My hands are probably out of your peripheral vision now, correct? Good. Just say yes when my hands are out of your peripheral vision. Are you ready? Keep focus. Let's begin. Good. Good. Let me know when my hands get into your peripheral vision, okay? Good. Which hand is closer, my left or my right hand, okay? So I'm going to put my hands here. You let me know which is closer, left or right. Let's begin. Left or right? Good. Left or right? Good. Left or right? Good. Left or right? Good. just measuring was distance between the eye. It appears at 14 to 13 inches away from the face that your eyes are still fluctuating well, which is very good, especially for reading. Okay. So I'm going to put these funny looking glasses on your eyes, okay? What I want you to do is just relax. I'm going to be putting lenses in front of your eyes, okay? And you let me know what you see. That's it. So I'm just going to set these carefully over your face, okay? And just a quick question, is that comfortable, or do you want me to adjust them a little bit? Okay, perfect. Okay, so they're kind of okay right now. Okay, perfect. So I'm going to do tester lenses to begin with. You let me know what you see. Okay, good. Okay, here is tester lens 1. And what do you see? Yes, the lens is on your face. I will give you 1 without, 2 with. What do you see? Okay, not so much going on. Perfect. Any difference? Not really. Okay, good. This is the trial lens. It's almost like a placebo effect. Okay. Now let's continue. Lens 2. Okay. Now lens 2 is on your face. Now what do you see going on? Okay, so it appears that I'll have to show you lens 1 again without. Okay. 1 without. 2 with. 1 without. And 2 with. Any difference? Okay, perfect. So this one actually is a slight blur. It is almost unseeable. Okay. Are you ready for tester lens 3? Perfect. Now, 1 without and 2 with. Any difference? This is 1 without and this is 2 with. Any difference with what you see? Okay, and it is red. Very good. Perfect. So I'm going to perform something now called the red eye or red dot test. What this is to see if you can identify other colors whilst the red is over your eye. Okay, good. So I'm going to get my pen light. Let me know what color is the light. Is the light red or is it blue? Very good. It is red. Okay. Now a little closer. Is the light red or is it blue? Let me know. Okay, it is still red. Okay. I'm going to put the light far away, okay? Is the light red or is the light blue? Okay, it is red. Okay. I'm gonna put the light very close to the lens now. Is the light red or is the light blue? Okay. Do you see the color of the light shift between the red and the blue? To some, it might also look like it's turning from yellow to white. Is that happening at all? Okay. I'm gonna move it around. Let me know if that happens at all. Okay, it does. Good. Let me know if it does. Good. Perfect. Okay. Now continuing with the red light test. How many fingers am I holding up? It is 5. Good. How many fingers am I holding up? 2. Good. How many fingers am I holding up? 3. Marvelous. How many fingers am I holding up now? 1. Good. Okay. I'm going to show you a little remote I have that has several different colors on it. Okay. Can you tell that on the remote there are different shades and colors? Or do they all look like different shades of red? Okay. Okay, they look like different shades of red. Okay. Any idea what this color is that my finger is on right there? Any idea? Do you think that was red before, or do you think it was another color? Okay. Perfect. Thank you so much. And that is the red light exam. Perfect. That is typically our tester lens, because we're also trying to see dynamically inside the eye. Red is the color that travels the farthest, and it actually can transform colors magnificently. I'll show you the remote. This is the remote that I was using. The color I was pointing at was this one, which was a blue. Right there. And we typically use these remotes specifically for eye color tests. Good job. Okay. Now we're going to find your prescription. I'm going to go from the strongest prescription down to the lowest. Okay, let's begin. We are going to start off with convex lenses. Are you ready? One without, 2 with, 1 without, 2 with, 1 without, 2 with. Okay. Do you see any difference? Okay. And what does the difference look like to you? Is the vision better, worse, or the same? Worse. Okay. Thank you so much. So you are not at that prescription. This prescription, if you can see, is a 10, which would be very close to my prescription, actually. Okay, writing that down. Okay, let's see what's next. I think I'm going to drop the prescription down several levels. Okay, here is the second lens. One without, two with, one without, two with, one without, two with. And is the prescription better, worse, or the same? Okay. And what are you seeing? Is it similar to the one prior? Okay, good. Now let me know which is better out of the two lenses. One or two? One or two? One or two? Okay. So two is better than one. Perfect. So that one was at a 3. Good. You're doing great. Okay. Let's check the machine. Good. And then let's check this side. Perfect. Okay, on to the next lens. Let me know. What do you think is better? One without, two with. One without, two with. One without, two with. Okay. And what is the difference with two, would you say? Okay, a little bit blurry. Is the vision better, worse, or the same? Okay, perfect. It is. Okay, a little bit worse. Okay, that was at a 5. Okay. Now let's compare two lenses. Okay. Let me know what is better. One or two? One or two? One or two? Okay, so two appears to be better in this case. Okay, let's write that down for the details. So that is at a 3, which appears to be better than prior. Okay, let's adjust the glasses now because we're going to switch to the concave spheres. And what that is, that's typically the opposite with the glasses, okay? Good. Okay, are you ready? It appears that the prescription of your convex sphere size was negative 0.75, which is very good. I would say that's out of 20 out of 20 vision. That is a 15 out of 20 vision. Great. Let's begin again. or 2 with? Okay. Is the vision better, worse, or the same? Okay, worse. So this appears to be perfect for your prescription. That's actually very good news. Good news for me to hear. Okay. We're going to lessen the prescription now. Okay. You let me know what is better, lens 1 or 2, okay? This is lens 1. This is lens 2. 1, 2. 1, 2. Which is better, 1 or 2? Okay, so lens 2. Perfect. I was double checking the prescription. Very good. So lens 2 appears to be better. Good. Okay. You're doing wonderful, by the way. And on to the last lens. Let me know which is better. Lens 1. Lens 2. Lens 1. Lens 2. Lens 1. Lens 2. Okay. Lens 2. Perfect. Okay. So that one is at a 1.5. And it looks like your eyes hyper-focused on 1.5, which was very good. That means that the convex was negative 0.75 and the concave was 1.50. That means that we can create the perfect glasses for you, by the way. Yeah, it really does wonders. Perfect. And that was the lens eye portion of the exam. I'm going to remove the glasses from you now, okay? You did wonderful. Just going to get that around your eyes. Okay. Good job. You did amazing. So, we have the negative 0.75 and then the 1.50. That is great. I'm writing that down on my notes, okay? Good job. Now we're going to do it's a different part of the eye exam, but it is drastically different than the other portions we've done prior. I'm going to test your eyes for color deficiency. Okay? And there is absolutely nothing wrong if you have color deficiency. In fact, I do. And I have several colors that I am unable to see properly. So, if you can or cannot see these colors, that is no problem at all. We're just here to fix your eyes and make you feel better, okay? So, I have this book here. And there are tests inside this book that test for color deficiency. Okay. I'm going to ask you just to identify to the best of your ability. And again, if you cannot see, that is absolutely no problem. Before we begin, I'm going to add an eye drop to your eye. And that is only to test properly for this portion of the exam, okay? Very good, relax. this medicine to your eye. Just gonna add that carefully close to your eye. Please look up, please. Okay. Carefully gonna add a little bit of that. I'm gonna go right there. I'm gonna go. Okay, other eye. Okay. Perfect. Okay, and I'm gonna ask you just to blink for me, okay? Good, I'm just gonna ask you to blink. Good, blink. 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 Okay. Your eyes might look a little different now. Can you tell? Yeah, they look great though still. Are you ready for your first test? Let's begin. Do you know what number is in front of you? Okay, let's see if you can see that number. Let me know. Are you able to see the number in front of you? Let me know in 5, 4, 3, 2, and 1. Okay, this is the number 12. Are there any shades that you cannot see in this? Okay, and what does this look like to you? Could you read the number? Okay, can you tell what color this is? This is a green. Can you tell what color the numbers are? That is an orange. I also have the notes at the back of this card so that I can also give you the right answers, okay? Good. On to the next one. Can you tell what number this is on the card? Okay. Any ideas what that is? Let me know in 5, 4, 3, 2, and 1. Any ideas what that number is? Good. This is the number 16. Was there any number that you could not read or could not tell on this card? Okay. The background is orange and the numbers are green. It's a flip of the original one. Okay. Round 3. Any idea what that number is? Let me know in 5, 4, 3, 2, and 1. Any guesses? Very good. That is a 7. And the shades are similar to the last one. Orange background, green number. Any difficulties with this one? Okay. Here's the next card. Any ideas what this number is? Let me know in 5, 4, Any difficulties with this card? This is the card that, in my opinion, causes the most troubles to people, as it is, in my opinion, the most difficult to read. Any difficulties with this? Okay, and the background is gray. The numbers are pink and purple. I have a difficulty seeing some purples, so to me these look almost identical. Okay. And are you ready for the final exam? This is the most difficult part of the test, I promise you. I have a photo in front of me that has 2 separate trails. I'm going to ask you to take your finger and I want you to trace the trail that is at the top. Okay? So put your hand on the paper and to the best of your ability, I want you to trace the trail that is at the top. Okay. Now try again. Good. Now do the same for the one on the bottom. Very good. You did fantastic. I'm proud of you. Good job. Now I get to write down your prescription and I get to write down your assessment for this. What we're going to do is, if there is a problem with the change in color, we write that down on your driver's license and our passport. Good. And are you ready for the final part of your test? We are going to try on some glasses and see which ones fit you best. Are you ready? Let's begin. I have a very large selection of designer glasses that happen to be super fancy. And if you'd like any of the 5 here, you just let me know. The first ones we have here are gorgeous. They are Gucci. Very fancy designer. You can see from the side, these are so beautiful. And let's see if these fit your style. I'm just going to place that around your face. Okay, and how do you feel? Okay, let me show you a mirror. Okay, I think these are a little bit modern, a little bit fun. Yes. Okay, let's try another now. These ones are gorgeous, super fun if you're kind of more of a modern person. Yeah. On to the next. Stunning. These are Valentino. Very designer. And we're gonna see if you like a pair like this. They are super pretty and they are absolutely perfect for looking very smart and bold. I'm gonna place this right there. Okay. And how do you feel? Perfect. Let me show you the mirror that's in front of you. Take a look. Okay, yes, a little bit 70s, a little bit bold. Are you liking it? these ones are actually my favorite. A lot of the clientele here, they call them the Harry Potter glasses. But these are really stunning frames. We have these right there. These are also Gucci, very designer. But let's see if you like the Harry Potter glasses. Okay. Okay, let's see. Put that right there. How do you feel? Do you feel like the boy who lived? Very good. And these actually give you a very good refined look. Are you a fan? Do you think that they look a little bit silly, like a costume? Okay, these are a no. That's okay. Moving on. Okay. I love these glasses that are coming up next. These ones. Oh, perfect. These ones are handmade and custom by the glasses technician here in the clinic. This is a gorgeous frame. Very classic, and these look super unique. Let's try these on. Okay, how do you feel with the lenses? I see a smile on your face. This one might be it, you think? We'll find out very soon. Super. Okay. These ones are beautiful frames, and yes, one of our technicians does make the frames here. She is very good and very skilled. Now on to the last pair. These ones are aviators. So these ones are gorgeous. I think these would fit your face perfectly well, especially because you have very nice cheekbones. So these are the classic aviators. Let's put these on. I'm personally a fan of these ones always. Okay. Okay, I see that smile. You like the aviators. Yeah, they actually do make your cheekbones again look super good, and because it's a metal frame, that complements your face very well. Okay, so which one shall we go with? The aviators. I knew it. Okay, we're gonna send these in on the technicians. I'll let you know in about 5 business days. We'll call you when the glasses are finished. Now, would you like to add anything to the glasses? What I mean by that is, I always like to alert people about this. We do have blue light lenses. And what these blue light lenses do is that they actually stop you from getting headaches when you're looking at a screen for over 2 hours a day. Would you like that included? Gorgeous. Okay, well, I think the exam is finished now. Thank you so much for completing and sitting here for that long. I really do appreciate that, okay? Yes. Thank you so much. And we'll have your glasses again in typically 5 to 10 business days, but we're not that busy, so I'll say 5. Okay. And I will also send you an email within the next 6 hours with the final results of your tests. Okay. So come back in when the glasses are ready and pick them up. Thank you so much for coming on by for your detailed eye exam today. And thank you for having patience with me and sitting here for this long. Yeah. great rest of your day now, okay? And again, I was Dr. I. Bye now. Cheers and enjoy the rest of your week. And get some rest. Okay, so we're going to send the aviators in. And it looks like we're also going to send in the prescription setting for the blue light exam so that they get the blue light lenses. Okay. Good. Okay, let's see now. Why? Hello there. Are you here for the eye examination? Yes, this includes the eye exam, a glasses fitting, and the lens 1-2 exams. Perfect timing, and as a nurse seen you. Marvelous, thank you for waiting. I am the eye doctor, Dr. Retina. It's a pleasure to meet you today. Yes, I'm just going to take a seat now and we're going to begin your exam. Is that okay with you? Marvelous. So, I was reading your chart here, and it does look like you are in need of a refreshment eye exam so we can update your information. Good. And have you had any troubles at all with your eyes or your perception of sight? Okay. Do you feel like you can see better up close, or you can see better afar? Okay. And have you had any troubles at all with your health in general? Okay, thank you. And just to double check, may I get your name once more? Perfect, and your birthday. I'm just going to type this into the computer. Good. Okay. Marvelous. Good. And do you wear any glasses or contacts right now? Or are you waiting to see if you are in need of a prescription? Perfect, thank you. Good. So, I'm going to be taking notes whilst I perform the eye exam, if that's okay with you, just so that we can update your paperwork. Yes. And the first question is, are you able to clearly see me? Just right in front of me. Good. I will begin the eye exam now. And what we're going to do first is sight and perception tests. I'm going to ask you, are you able to see my hand right here to the left side of you? Good. And right now, are you able to see my right hand to the right side of you? Perfect. And do you have any color deficiencies in your eyes? Perhaps you are unable to see reds, blue, green, etc. Okay, thank you for letting me know. What I'm going to do first is I am going to check luminosity and light in your eye, okay? And I'm going to be checking each eye. So I have a pen light here,
natural eye color. Gorgeous. Okay. Take a quick look first. If you could you keep your eyes right there at the letter E? Yes, we do have, it's called a Snellen's chart. We will be examining your eyes with that afterwards. Keep a look at the letter E. I'm just going to first take just a quick look right in front of you. Take some notes down as I just take a quick look at your eyes. Just going to make sure. Just make sure that when I do, just take this. So it looks like the eyes are just having a quick visibility look. I'm just going to just be over here to the side, just a little bit to the opposite eye, which happens to be the right and the left. So just take a quick look with the light, the luminosity that happens to be there. Just going to make sure that I do see just a good look. So just from far away, I'm just going to see it up close. Just a little close. So it looks like eye stability is perfect. In regards to movement, okay. I'm going to cover one side of your eye now. Do you have a preference which side? No, perfect. I'm just going to cover right here on the right side carefully, okay? Are you able to see at all the other side? Good. Let me know when you're able to see the light. Just say yes when you do. Perfect. And now good. And now good. And now good. And tell me when you can see the light. Perfect. And tell me when. Perfect. Tell me when. Perfect. Great job. Now I'm going to try this again with the opposite eye, okay? And tell me when you're able to see the light by saying when. Are you ready? Perfect. And tell me when. Good. And tell me when. Marvelous. Tell me when. Good. And perfect. And now good. And now good. And now. And tell me when you see the light. Perfect. Okay. You can relax now. I'm going to ask you, when do you see that the light is closer to you? I'm going to show you 1 where the light begins and 2 where the light ends. I want you to identify when the light is closest to you. I'll give you an example for me. This would be 1 for me, and then this would be 2. I would ask, when is the light closest to you? And I would repeat, 2 would be. Are you ready? It's just a perception test. Let's begin. So, this is 1. This is 2. Which is closest to you? 2. Good. Okay, this is 1. And this is 2. Which is closest to you? 1. Perfect. This is 1. And this is 2. Which is closest to you? 2. Good. Let's begin again. This is 1. And this is 2. Which is closest to you? 2. Great. Now, what I'm going to do is I'm going to just take a look at your eyes, and we're going to see if you have an expanding pupil. is going to be a vitamin solution to your eyes, and it's going to just carefully put a drop into the eye to add moisturization to it. And you can actually see the solution is clear. I'm going to carefully just tilt your face a little up like so. Going to add 3 eye drops in this one eye. Just keep your eye open, okay? 1, 2, 3. Good. Now the other eye. Just going to carefully move the eye. Good. Just stay like that. Good. Going to just add 1, 2, 3. Good. Just going to carefully move like so. And now what I want you to do with me is I'm going to ask you to close your eyes and open your eyes, blinking to get the solution in your eye. A lot of people tell me this is the relaxing part, and some people do fall asleep. That's okay. I'm going to ask you to close your eyes now. Follow with me. Open your eyes. Close your eyes and open your eyes. Close your eyes. Open your eyes. And once more, close your eyes and open your eyes. Very good. Now I'm going to add a secondary solution, which is going to, it's what we know as the pupil examination solution. It's going to make your pupils larger so that I can see into your eye. And this solution is the one that actually can give your eyes a slight tint. Yes, like a tinted window. It's going to make them a little yellow. So, I'm going to just ask you to look at me now. I'm going to just add 1 drop here. And perfect. And the other drop in the other eye. And perfect. Good. Now we're going to ask you just to follow suit with closing and opening your eyes again. So, what I'm going to do is I'm going to ask you to follow with me. I'm going to ask you to blink. Good. Open your eyes. Close your eyes. Open your eyes. Close your eyes and open your eyes again. Yes, do you feel like your eyes are getting quite relaxed? Perfect. And there goes the 2 solutions that we've added to the eyes. Now that your eyes are properly reacting, I am going to take a look deep into your eyes. And I have this glasses treatment. It does look a little bit funny, I understand. Where I am going to look close into your eyes, and you will see these are magnifying glasses. next one. We've got a shape here that is more recognizable. It has 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 separate angles. What is this? This one is a star. Perfect. On to the third one. This is to assess dynamic eye assessment and memory. What is this shape? A circle. Marvelous. That one was quite easy for you, wasn't it? Good. Now on to color assessment. I am someone who has color deficiency. There are colors I am unable to see, such as a very light pink and a light purple. I cannot distinguish the difference between those two. And I have a difference in how I perceive neon colors, such as orange or red. They look the same to me, so it's okay. Are you ready to begin? I want you to let me know when you see this card, what is the associated color? Perfect. This is yellow. Wonderful. On to the next one. We do have a card here which may be a bit more easy. In orange. Marvelous. I do see your eyes getting a bit tired. It is okay to close your eyes for a little bit. And on to the third card. And what is this? This one looks to be money. This one is green. You did amazing. Now I'm going to show you two separate objects. I want you to let me know which one is purple. So I have two objects here. I want you to let me know which one is purple. Is it in my right hand or my left hand? Take a look. Perfect. It is on your right side. Marvelous. I'm going to ask you to follow the purple egg and do not get distracted by the green egg. Okay? Just look at it and focus. This is a focusing test. Are you ready? Let's begin. Look at it and don't get distracted by the green egg. Good. 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 Very good. Perfect. Good. Good. That was amazing. Great results. Thank you so much. Now what I'm going to do is I've let your eyes adjust to the eye drops I added. So now I am going to be calculating the distance between your eyes and your pupils. I'm going to ask you to sit very still, okay? This is a easy procedure, and then we are going to move on to my favorite part of the exam, which is our lens exam. Are you ready? Perfect. So I'm going to ask you to sit still for just 2 seconds. I'm going to make my adjustments. Looks like we're going to go for perhaps a 7.5 to a 9.2. Looking at around 4.23, 4.24. looks like your eyes are equivalent with each other, which is phenomenal. Mine aren't. Wonderful. And are you feeling okay right now? Perfect. Would you be okay if we proceed along to the next exam? So, with that information that I found by calculating your eyes, we are able to assess what type of glasses and lenses we can place on you and how we can create the perfect glasses for you. Yes, exactly. So, I'm going to just set this down carefully, and right before we begin that, I have an exam where I have a tool here, and this is actually going to add air and test your eyes for reflexes. Are you ready? Perfect. I'm just going to get carefully close to you. I'm going to ask you to sit still, and I want you to let me know if you're able to feel the air just blow on your eye. Okay, 3, 2, 1. Perfect. One more time. 3, 2, 1. Good. And onto the other eye. 3, 2, 1. Perfect. 3, 2, 1. Good. And either 4 times I've tested, you were able to feel the air just carefully apply to your eye. Perfect. So that is a test to see if your eyes have movement and reflex. So you have nothing else going on. Good. Marvelous. Now, this is where we're going to use the Snellen's chart, and we're going to test your lenses. So let me show you. I have a magnificent lens kit here, and I'm going to just show you. This is what prescription glasses are. And what we have is sets of lenses in different formats, where each lens has a dynamic appearance and effect on your eyes. I'm going to show you this one and put it right on your eye. This may or may not make your vision better or worse. Correct? Perfect, so you do see. Marvelous. What I'm going to do is I'm actually going to apply the lens glasses to your eyes so I can test 1 or 2. This is what they look like. And I'm just going to place this right on your eyes and behind your ears, okay? Good. I'm going to just carefully assess that right onto your eyes. And let me know. Is that comfortable? Good, that's what matters most. So, first thing that is first, I do have to give you 1 trial lens, and you have to let me know if this lens affects any part of what you see. Are you ready? Let's begin. Let me just add that to the lenses, and this is the trial lens. What does this lens make you see? Perfect. So you should be seeing everything in red. Lovely. As they say in French, viewing life through rose-colored glasses. Perhaps this one's a bit more red, but you do see. Good. Let me remove those. And are you seeing normally again? Marvelous. So it looks like the trial lens passed, so we are going to test your eyes now. I'm going to go in order of a higher prescription, such as a -10, and we're going to go and work lower down the line to a lighter prescription. Is that okay with you? Good. So, with the 10 prescription and a concave sphere, you will notice that things in the background might be more visible to you, and things in the foreground are more difficult for you to see. Are you ready? Let's begin. Let me know what you see. Is that what you see? Perfect, so it did work. I know that this is not your prescription, but just to make sure that it works. Now let me know which is better. This is one without lens. And this is 2. Which is better for you? 1 or 2? 1 or 2? 1 or 2? 1. Perfect. So, it looks like you are able to see the difference between normal vision and the lens. Good. This is mostly where I take all my notes. Now, are you ready for the lower prescription? Good. So, I'm going to take 2 prescriptions now. I'm going to ask you which one looks better, 1 or 2. You ready? Let's begin. What looks better? 1 or 2? 1 or 2? 1 or 2? 1 or 2? Good, so it looks like you liked 2 more. And were either of them very good reflections of how you see life? Not so much. Okay. Let's try this again. Are you ready? Let's begin. Which looks better now? This is 1. And this is 2. 1, 2, 1, 2, 1, and 2. Which looks better to you? 2. Marvelous. And is that lens any better of vision for you, or not so much? No. Okay, so we are first at, looks like prescription 4. Okay, are you ready? So, I'm going to ask you which is better now. What looks better? This is 1, and this is 2. 1, 2, 1, 2, 1, and 2. Which is better? 1. Perfect. 1. 3.5. Perfect. Looks like we're getting closer to the baseline. Okay, let's begin again. Are you ready? Good. Which looks better? This is 1. Yes. This is 2. 1, 2, 1, 2, 1, or 2. Which looks better? Good, so you are saying that 2 looks a little bit more clear. And does 2 look like better vision than normal? Not yet. Okay, good. You're doing phenomenally, by the way. Okay, now let's do this one more time. saying that one looks better, which puts you at a negative 2.5. Okay, I'm going to put the lens on your eye now, and we're going to be working with the Snellen's chart. Are you ready? Let's begin. So, I'm going to use the same little tool I used before. I'm going to apply the lens to your eyes. Okay, as you can see, perfect. So I'm going to ask you, can you still see the first letter? Good, and what does it say? It says E. Marvelous. Can you read the third line for me? What does that say? It says T, O, and Z. Marvelous. Okay. Can you read the sixth line for me? The sixth line. Yes. It says what? E, D, yes, F, C, yes, Z, and P. Marvelous. Now this is without. I took the lens right off of your eye. Are you still able to read those lines with the same type of accuracy and precision? Okay, can you read line 11 for me right now? No. Let's apply the lens one more time then. Can you read the 11th line for me now? Perfect, and can you read it for me? Yes, P, E, Z, O, L, F, C, F, T, D. Marvelous. I took the lens off again, so it does look like you were at the negative 2.5 for what we were examining, which was known as the concave lens sphere. So that is when the reflective vision gets perceptually better up close due to farther distances. Marvelous. Okay, and looking at that. Good. Now we're going to test the opposite, which is known as the convex sphere. So, concave and convex. Let me show you. So, this is the strongest prescription for the convex sphere. This is negative 10. I'm going to ask you to let me know what visuals you see when I apply the lens. Are you ready? Let's begin. So this is the convex sphere. If you can see quite detailed up close, correct? Yes. And then I'm going to just take a look up close. Exactly. And it looks a little bit more blurry from the background. Is that true? Yes. You do need a mixture of both concave and convex for your lens, so we're going to test your eyes. Are you ready? Let's begin. So, I'm going to pick up separate prescriptions once more. Are you ready? Perfect. Let me know which one is the better vision for you. Are you ready? This is lens 1. Lens 1. Lens 2. Lens 1. 2. 1. 2. 1. And 2. Which is better, 1 or 2? 2. Marvelous. So looks like that is once more 3.5 prescription. Good. Okay, let me know which is better again. This is lens 1 and 2. 1, 2, 1, 2, 1, and 2. Which is better? 1. Perfect. So at the third prescription, you're doing amazing. or 2. 1 or 2. 1, 2. 1 or 2. 2. Perfect. So this is a convex sphere of 2. So negative 2.5 for the concave, 2 for the convex. Marvelous, thank you. Great. And I'm going to put the lens on you now. And we're going to retest again with the Snell lens chart. Are you ready? Good. So this is 2. If you can see, it is a slight bit clearer. Are you able to read the Snell lens chart with as accuracy as without? Let me show you without. This is without. Can you read that at all? Okay, and let's do width. Did it make the vision better or worse? 1 or 2? 1 or 2? 1 or 2? 1 or 2? Okay, so with the second lens, it looks like you had better details up close. So you've said correct, and when you do add the lens, it actually makes it more difficult for you to read the Snell lens chart. Perfect. So when we mix the two lenses together, let me show you. It's phenomenal. 2 lenses together, and let's separate together, and let's separate the lenses. It looks like the refraction of your eye also changes, so I'm going to move the prescription down to a 1.75. Perfect. And we are creating the perfect glasses for you. That's what we do. We test your lenses for your eyes. It's magnificent. Yes. And now, what I'm going to do is I'm going to take those glasses off of your eyes, because what we're going to test next is how the lenses actually fit your eyes. I'm going to remove that from your eye. Perfect. And I'm going to ask you, can you look at me? Good. Can you follow my hand? Good. Follow my hand. And below, follow my hand. Good. And then follow my finger. And above. And below. Good. Are you seeing any better right now, or are you seeing the same? Okay. And do you see a difference with normal vision in comparison to the lenses? Okay, so you do. Marvelous. Great. So, what we are doing next is we're going to fit glasses onto you. So I did measure the eyes. So what we're going to do is I'm going to show you some glasses that I have that will fit the shape of your eyes in comparison to how your pupils are in measurements. Are you ready? Perfect. So I have a collection right here. And this one, I'm going to just try on all of these lenses onto you to see which one would better shape and frame the face, and also the perfect precision with how your eyes are measured. Are you ready? Perfect. I'm going to put that down. And I'm first going to start off with these glasses. All of these are prescriptions and will be given to you as soon as you can assess which one you like the most. Are you ready? Let's begin. So I'm going to hand you a mirror. Here's the mirror. Perfect. And I want you just to look at yourself in the mirror and tell me which glasses do you think make you look the best and make you feel the best. Are you ready? Let's begin. So, I'm going to first just apply these onto your face. but I do think that the frame suits your shape of your face well, and it is equal to your pupil size. Good. I'm going to just take that one off now. Good. We're going to move on to the next set. So these glasses I'm going to show you next are a bit more detailed. These ones are designer glasses, and these are Louis Vuitton. Yes, so a bit more of the luxurious side, but these will blend in with any kind of clothes that you wear. Good. Let's try these ones on. Okay. And with these glasses, how do you feel? A bit luxurious, yes. These are more of a color assessed frame. The prior one was a black and gold frame. This one is red and clear. Yes, because it is made out of an acrylic polymer. Perfect, yes. Do you like this one? Not so much. Let's try another. So this one's a bit more bold, that's why. If you can actually see, the lens size is 55 in comparison to the other, which was 52, and larger frames sometimes can go a bit more uneasy. I understand. Okay, let's move on to the third. This one is also designer. This one is Valentino. Yes, quite nice. Again, similar to the first frames, as these ones are again a bit more of the square type, but the lenses are a 32. So let's try this on. They even have a turtle shell design. Gotta just put this on your face. Take a look in the mirror. Okay, and how do you feel? Look in the mirror. Perfect. So these ones complement you quite well. I do agree. They also make your eyebrows look quite nice. Yes. You like these ones? Okay. I'm going to just take that off of you now. And we're going to put this one to the side so that this may be your pair. On to the next one. So, as these ones are designer as well, these ones are Gucci. And if you can tell, with the Gucci glasses, we have a cat eye type frame, which are a bit more of a centerpiece, like a staple glass. Is not necessarily perfect for every day, but definitely something if you want to show that you mean business. Yes, let's try these ones on. Are you ready? Perfect. Now, what do you think about these ones? Yes, they are quite bold, and they do make you look very stunning. I do say so myself, yes. So, do you appreciate the glasses? I know you like these ones, but not good for every day. I understand. Let's just remove them. Good. And then we have one more, which is a staple set of glasses. Most people actually commonly wear these glasses. So these are very common. These are Tom Ford. Very expensive, but these are the very classic glasses look. If you notice someone wearing glasses, they typically look like this. Let's try these ones on. And I'm going to just apply that to your eyes. And how do you feel? Stunning, right? I know. And they do sit really well on your face. Now you're conflicted which one you're going to choose. Let's try the other ones on so you can choose. Are you ready? Remove that. Good. And then let's try on the prior one, the Louis Vuittons. Are you ready? I'm going to apply that and you let me know which one you like best. Perfect. So you think the other one is better for you. Understandable. Let's remove the glasses. let's just remove that then. And what we're going to do is I'm going to set your prescription in so that your perfect glasses can be made with this frame. And I'm just going to write down that you had your certain set of prescriptions which we found today. And that we're going to make the glasses as soon as possible. And would you like sunglasses built into the glasses? Whereas you take a step outside and your glasses will turn immediately into sunglasses. Are you not interested? Okay. And would you like blue light reflecting glasses? Do you know what those are? We can add a layer onto the lens of your glasses to stop your eyes from getting tired from looking at a computer screen. Perfect, we'll add that on this. And would you like a 1-year warranty with these glasses? I do. Okay, good. Perfect. So, I have your prescription sent in. We are going to send these glasses into our eye department who will create the perfect lens for you. It's going to take about 7 business days, if that's okay with you. Yes, in the meanwhile, I am going to have my nurse bring in a set of contacts for you. And we're going to just quickly allow you to get a pair of sunglasses out. So the nurse is going to come in with some sunglasses and a pair of contacts for you until the day that you get your actual set of glasses, where we will call you and let you know they're ready. Does that sound okay with you? Perfect. Again, it was an absolute pleasure to meet you today. I'm glad we got your perfect glasses and your perfect prescription. And I'm going to ask you to relax for 7 days until you get your actual glasses. No long journeys. Just relax, sit down. Okay? Does that sound good? Perfect. Thank you so much for coming on by to the eye clinic. And I hope to see you very soon. Perfect. Cheers, darling. Perfect. Oh, hello there. Welcome to Dream City Eye Clinic. I'm Dr. I. I know I'm not your normal physician, but I'm in for today. Pleasure to meet you. Truly. And are you someone who's already checked in with the front desk? And they sent you to me? Perfect timing. Please come on in and take a seat. There's a chair about a meter ahead of me. Go ahead and just get yourself cozy, okay? And how are you on this fine afternoon? Perfect. And could I get your name so I could check you in? Okay, and how do you spell that? Okay, and what's your last name? Okay. Beautiful name. What's your birthday? Okay. And just to make sure, we have 2 different options for you today. We've got the first, which is a fast and aggressive lens exam. We're going to find your prescription pretty fast. Or we can, if you have a little bit more of time, we can just go through a detailed explanation of lens by lens by lens. What are you here for today? You've got a pretty tight schedule, so you'd like to do the fast and aggressive one. Perfect. Just the other option I explained to you why each lens is different. So perfect. And quick exam before we begin. May I touch your face? Good. I'm gonna ask you to look at me. Good. Have you had any eye problems in the past 2 weeks? Okay, what about the past month? Okay. If you could look up for me, could you quickly tell me if you think that your eyes have gotten better or worse since last time? Okay. Good. Could you look down at the ground? Just gonna touch your orbitals. And I'm just gonna put a little bit of pressure here. Pressure 1, 2, 3, and release. let me know, did that feel any pain or no? Okay. And are you liking your prescription now? Do you like how your eyes work right now, or do you feel like you could do a bit of fine-tuning? Or is your vision a little bit blurry? Do you feel like things are a little bit too far and away? Okay. Okay. Could you quickly follow my finger? Good. Follow my finger. Good. Follow it up. Follow it down. To the diagonals. Just to the diagonals. Good. And quick question. Can I cover an eye really quickly? You still able to see that Snellen's chart? Good. How many fingers am I holding up? And now. What about now? What about now? Good. I'm gonna cover the other eye. Can you see my shoulder? Good. How many fingers am I holding up? And now? What about now? What about now? Good. And quick question. Just a quick question. Just a little bit of a quick question before we begin. Are you comfortable with me applying these glasses onto your eyes? Okay, so I'm going to give you a quick example here. Gotta quickly put these on your eyes, okay? Let me know if they're uncomfortable at all. Just gonna put these spectacles right on you. Okay, and do you feel comfortable? Good. So, I'm gonna first place this first lens on you. It's gonna be very obviously blurry, but it's our strongest prescription, okay? So I'm just gonna apply this right under the eye. And you let me know. Is the vision better here? 1 or 2? I'll do it again really quick. 1 or 2? 2. Perfect. And what this does is we can fine-tune your prescription. Okay, quickly. I'm just going to use a magnifying glass and shine the light right into your eyes, okay? I'm going to test each one. Here's the first one. Look at the light. Good, 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 good. And the other one. Look at the light. Good, 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 good. Very good. And can you just get a little bit close here? I'm just going to shine the light one more time. Now don't look at the light. Very good. And it looks like you're having very good reactive eyes, which is what we're looking for. So, we're going to start off with an accessory. This is an accessory lens. And you let me know what you see. Can be anything at all, or it can be nothing. So there's different types of accessory lenses. So we're going to start off with this one and describe to you really quickly what you see. Okay, I'm just going to apply this lens right onto the glasses. Now we're going to use the Snellen's chart as our example, our baseline. What do you see with the Snellen's chart now? Everything is red, but you're still able to see the letters perfectly. And what about me? Everything's in red. Perfect. You're doing great. Okay. We're going to go with the second prism now. These are called prisms. So just quickly let me know. I'm going to apply it in 3, 2, 1. And let me know what you see. You see nothing at all. Perfect. Let me know what is better, 1 or 2, and what you see. There we go, 3, 2, 1. This is the lens. Not much of a difference. Okay, great. So this one actually is known as the placeholder. It has no different lens to it. So good job. Now we're going to begin with the actual lenses. We're going to start with the concave sphere and then we're gonna go all the way to the convex sphere. Okay, we're gonna speed this up so we don't waste any of your time. Okay, so let me know what's better, 1 or 2. This is 1, and use the beautiful Snellen's chart as a way to see and assess if the vision's getting better or worse. 3, 2, 1. 1 or 2, and this one's 2. Okay, what's better, 1 or 2? Okay, got it. So, you're saying that 1 was better. Let's go to a lower prescription. 3, 2, 1. This is 1, and look for 2. What's better, 1 or 2? This one's 2. Okay, let me show you 1 again. This one's 1. This one's 1. And this one's 2. This one's 2. Okay, so you're seeing blurriness and the definition's gone. Understandable. This one's 2. This one's 1. Which one's better? Okay. We're gonna go to a lower prescription now. We're gonna go to some of the more refined lenses. Here we go. 3, 2, 1. This one's 1, and this one is 2. What are you seeing? Okay. And this one's 2. Let me show you 1 again. This one's 1. Okay, and this one's 2. So what do you see? Okay. Back to 1. Back to 2. Back to 1. Back to 2, back to 1, and back to 2. Which one's better? 1 is better. Okay, and I'm going to show you 2 again. I want you to let me know what are the things that you see that are a bit different. It's actually very defined with the Snellen's chart. Okay, you can see the letters, but what's different about this lens in comparison to the other? My face is a bit blurry. Understandable. Because it is a concave sphere, that means things behind me are going to get a bit more detailed than things around. Okay, let's go to a lower prescription. This one's just a smidgen lower. So, here we go. This one's 1, and this one's 2. Okay, ready? And this one's 1, and this one's 2. One more time. This one's 1, this one's 2. And what do you think? Which one's better? 1? Okay, this one's 2. And I want you to let me know what's different about this lens in comparison to the other one. Still detail in the back, but my face is a bit blurry again. Understandable. So, I'm gonna grab 1/2 prescription up. Here we go. This is 1, and this is 2. What are you seeing? Okay, the back is still very fully detailed. That's good. Are you able to see the lens kit that's behind me? Okay. And what about my face? What does it look like to you? Okay. So it's, again, a bit blurry. Okay. This one's 2, and this one's 1. Which do you prefer? 2 or 1? 2 or 1? Just refining your details now so we can give you the best prescription. So, we're going to go down the line again. This time, this one again is the lowest. We have one more lower one. We're going to test you. Here's 1, and here's 2. How's it looking? I'll show you 1 again. This one's 1, this one's 2. And let's show you 1 again. And this one's 2. What do you think? Details behind are perfect. Again, that's because of the concave sphere. But my face is again just a slight bit blurry. Okay. And we're gonna go to the lower prescription below that. Here we go. This is 1.25 for the prescription. In comparison to your other prescriptions, it's just a tiny bit higher. So we're just going to, this is 1 and this is 2. How does it look? Again, just a bit different, okay? And this one's 1, this one's 2, this one's 1, this one's 2, this one's 1, and this one's 2. What do you think? Okay. So again, the sound chart is really detailed behind me. You can still see the lens kit, and my face, again, just a bit blurry. Understandable. So, what this means is that we can actually keep the concave sphere for your lenses fine. We're going to move now to the convex spheres. I'm going to do something that's a bit strong. This one will be very obviously different. So this is 1, and this is 2. And what do you think? What are the differences? Yes, so it actually made your visual field a bit smaller. And do you notice that the vision is better or worse? Worse. Okay, so this is 1, this is 2, which is better, 1 or 2? 1 or 2? Very good. Okay. We're going to go to a very much so lower prescription now. Ready? 3, 2, 1. This one's 1. And this one's 2, which is better. 1 or 2? 1 or 2? Okay, so 1 is better, but what's the difference between 1 and 2? This one's 1. This one's 2. So my face is getting some detail, but not too much, and the background is still a bit blurry. Okay. And the opposite should happen with the concave sphere in comparison to the convex spheres. And that's because they are quite literally the opposite of one another. So we're going to go to, again, a very lower prescription comparison. And this one is about 2 or 3 prescriptions stronger than your last prescription for your main vision. So here we go. This one's 1 and this one is 2. How's it look? Very nice, but is it perfect? I'll show you 1 again. Show you 2. Showing you 1. Showing you 2. Showing you 1 and showing you 2. This one is 1 again, and this one is 2. This one's 1, and this one's 2. Which one's better, 1 or 2? Okay, so 1 is a bit better, and 2 is here. How do you feel about 2? Not too bad, but not the best. Okay. It's funny because these spheres have 24 sides, and it's a little bit funnier, but this one has 25. So going to actually give you a very low prescription now. This one is about 1.5 times stronger than your normal prescription. So this is 1. Tell me which is better, 1 or 2. This is 1. And this is 2. Okay, this one's 1. And this one's 2. What are you noticing? What's different between 1 and 2? Everything actually looks pretty similar. Understandable. That's because your eyes naturally look for the concave type because of your last pair of glasses. Okay, and what else? It's not perfectly there yet. Okay, good. Just refining your prescription and fine-tuning it now. And we're gonna go to one of the prescriptions just a bit above your normal prescription. So this is 1. Tell me what's better, 1 or 2. This is 1. And this is 2. This is 1. This is 2. This is 1. And this is 2. This is 1. And then this was 2. What do you think? Okay, so this one is perfect. Perfect. That's exactly what I would have expected. But which one was better though? Was it 1 or was it 2? Let me try it again. Which one was better, 1 or 2? Was 2 a bit better? Do you see more details or is it the same? A bit more details, that's perfect. That's because that's in contrast to your actual prescription. Perfect. Okay. So now that we just looked at the spheres, we're going to look at these cylinders. And what cylinders do is they can refine the lens. So we're going to look at concave and convex cylinders. So I'm going to give you the strongest one first, as I always do. This one's going to be the concave sphere. Now let me know what's better, 1 or 2. This is 1, and this is 2. Do you see the difference? Yeah. So what the cylinder does, it just makes it a bit more round. Again, this is 1. This is 2. Which one's better? 1. Okay. And we're going to go to a very much so lower prescription. This is 1, and this is 2. Tell me what's better. Again, 1 you think is a bit better. Let me show you 2 again. Let me show you 1 again, and let me show you 2 again. What do you think? Okay. But does this make the image a bit more dynamic? Okay, I'm going to show you a lower prescription. And this is the lowest prescription for the concave sphere. So this is 1, and this is 2. Okay, this is 1, this is 2. This is 1, and this is 2. And what are you noticing with lens 2? This one's actually a pretty good lens, but what's different? Here's 1, and here's 2. Yeah, so you're seeing things a bit softer. Perfect. That's actually what I would have expected, especially because your prescription is a bit more towards the convex side for making your eyes see 20/20. So we're going to test the convex cylinders now. I'm going to do the strongest one. This one actually has a bit more of a difference. This one's 1, and we're going to show you 2 next. Tell me which one's better. This one's 1. This one's 2. This one's 1. And this one's 2. What do you know that's different? Okay, it's a bit blurry and a bit rounder. Okay, and this one's 1 and this one's 2. What can you see also that's different? Makes the shape a bit more oval. That's perfect. But which vision do you think is better, 1 or 2? This is 1, this is 2, this is 1, and this is 2. So you think that without is better. Perfect. Okay. We're going to go to a lower prescription now, halfway through. So this is 1 without, and this is 2 with. A lot of people actually like this lens. Yeah, do you like this one too? Yeah, so your eyes actually will naturally want to adjust to something that would show a bit more of an image. So this is 2, and this is 1. Which one do you prefer? This is 1, this is 2. Okay. So you like that the image became a bit more wider and oval. Write that down. We're almost there to finding your prescription. We've got 1 more lens left, okay? Here we go. This is 1, this is without, and this is 2 with. What do you think? It's a great lens. I can see that you like this one. Are you able to see the Snellen chart behind me still? Perfect. Now what about my lens kit? Good. Now this is 1 without, and this is 2 with. Which do you prefer? 1 or 2? 1 or 2? 1 is without, 2 is with. Okay, see? So you actually prefer the convex cylinder at a prescription that's 0.25 stronger than what you chose prior. Good. So that we have your improvised prescription, we're actually going to take those glasses off of you now because we're done with the exam. I hope I didn't waste too much of your time here. I wanted to do this as fast and accurate as possible. And what's going to happen now is that I'm going to print out your new prescription, and you can go and take it to any glasses place that you would like to fulfill your prescription with a new pair of glasses, or you can give them your old pair of glasses and get the new prescription, okay? Perfect. Thank you so much for coming on by again. I'm Dr. Eyes. Again, it's a pleasure to meet you. And I'm not your normal physician, but you can come in at any time. Thank you so much for your time. And I hope I can see you soon to make sure that the glasses are perfect. Great. Have a good night.